right, Lee at the table, we're going to get an adjustment today. This is Nicole. She's volunteered to get an adjustment between patients. This is called a high-low table. Put your hands down beside your hips, and what we're doing is just getting to a neutral postural position. This is a leg check analysis. Leg check analysis, there's nothing magical about it. It is just a muscle tone indication of our neurology in our body. So if we get a neurological irritation, it changes the postural tone. It's kind of a sympathetic parasympathetic reaction to irritation, physical irritation, and we get a small amount of that retoning anytime we irritate a joint. So this is based on a technique called activator, and we've done some advanced activator and developed some of our own technique stuff, and so that's what we're going to see right now. So turn your toes out, hold them out, relax. What we're doing to start with is just stressing your pelvis, and we're looking at that as a three-dimensional stress analysis. Push your toes together, relax. And Nicole has a left lateral ischium. Squeeze your knees, relax. And this is a common finding. What we're doing is getting the sacroiliac joints to neutral here, or getting our pelvic mechanics to neutral. And the sacroiliac joints are the main drivers of that. This is your sacral bone in the center, and then we have an ilium bone and an ilium bone here. So we have a sacroiliac joint here and a sacroiliac joint on this side. So this is the ischial bone. We're just using this as a lever arm to affect these sacroiliac joints. Again, just getting those to neutral. The reason we want neutral mechanics is because it limits something I call bracing patterns. These bracing patterns can affect your core of your body, and it can also affect the extremities. Typically, your body is more concerned functionally about the core function. Put your left hand on your back now, please. Back down, right hand on your back. Back down, raise your left hip off the table, back down. And this is an L3 finding, third lumbar stress. I'm going to raise this whole leg up now, please. Back down. I'm going to raise this whole leg up, back down. And so she's just stressing those sacroiliac joints in different ways. And so now we're going to work on her sacrum. Sacral joints have two parts to them. We call it upper and lower boot. And so one part of that is a fibrous joint, and the other part is a movable synovial joint. But there's only a small amount of movement, about 3 degrees of movement in the sacroiliac joints. But it is important for them to be stress-free and neutral because they do drive a lot of what happens in the low back and lower extremities. Okay. So, looking at this pattern of stress, we're going to do some specific mobility now. Breathe in and out. This is breathe in and out. Breathe in and out. These are some mobilization techniques that takes care of a lot of the splinting in the spine. So we have what we call splinting and bracing patterns with these mechanical adaptations. I've been adjusting patients for about 28 years now, so I do a lot of pattern adjusting because we have repetitive patterns of misalignment and stress, and then we can get more specific with things. This is some cranial adjusting that we're doing right now, cranial stress patterns that relate to our core stress patterns. So again, we're trying to release all of these things and get the body to as neutral as we can to try to limit any kind of bracing and splinting musculoskeletally, and that just improves our function and decreases stress in the body. So the important part of that, symptomatically, is that by decreasing the physical stress in the body, we're decreasing the physical source of inflammation in your body. So that gets your inflammation down, and we also talk to patients about metabolic inflammation as well as stress-based cortisol production inflammation. So holistically, we're trying to decrease your inflammation load overall and that should decrease your symptomatic level, and that's where we start to improve function, improve health, and get you back to feeling 10 years younger. Okay? So Nicole's going to feel about 8, I think. Here we go. That was our adjustment. How you feeling, Nicole?
Good.
Good.